Welcome to the channel dedicated to natural healing, healthy aging, and nutrition science inspired by the teachings of Dr. Josh Axe. If you're over 50 and want to support your body naturally, from gut health and collagen to heart and brain protection, you're in the right place. Subscribe and join a community committed to living stronger, longer, and healthier, naturally. And what scares me the most as a surgeon with over 32 years of experience is that most seniors never realize the danger until their body is already crashing. Sepsis forces your immune system into a state of panic, flooding your bloodstream with chemicals that attack your own heart, lungs, kidneys, and brain. And once those chemicals take over, blood pressure collapses, breathing changes, confusion hits, and organ damage can begin within minutes. But here's the part nobody explains clearly enough. Sepsis almost always gives early warning signs at home before it becomes deadly. As a surgeon who has treated thousands of seniors, I can tell you with total honesty, you can stop sepsis early if you know how to recognize the first clues your body gives you. And note, this doesn't require any medical equipment or complicated tests. It just requires a few simple home checks that instantly reveal when your body is fighting something more serious than a regular cold or minor infection. I've seen patients survive because they caught these early signs. And I've seen patients decline because nobody at home knew what to look for. That's why this video is so important, because today we break down 5 powerful home checks seniors can use to spot sepsis before it's too late, ranked from the least urgent to the most critical. And make sure you stick around because home check number 2 is the single most reliable early warning sign according to major hospital systems. And studies show it can appear hours before the body begins to fail, making it one of the strongest life-saving clues you can recognize at home. Reference notes for this video are listed in the description. Before we continue, here's a quick question for you. Have you ever had an infection that suddenly got worse overnight? Share it below. I'm reading every single comment. Now, without any further ado, let's begin because home check number 5 is something almost every senior ignores until it's far too late. Number 5, do the skin squeeze test every morning. Let's begin with something you can do in literally 2 seconds. Yet it reveals crucial information about what is happening inside the body. This is called the capillary refill test, and it tells you how well blood is flowing through the smallest vessels in the body. When sepsis begins attacking the system, one of the first things it does is cause the blood vessels to behave abnormally. They start to leak. They lose their ability to constrict and expand properly, and blood flow to the extremities begins to suffer. This happens before many other symptoms appear, which is exactly why checking the skin can catch sepsis in its earliest stages. To perform this test, you simply take the person's hand and press firmly on their fingernail for about 2 seconds. You want to press hard enough that the nail bed turns white or pale, then release the pressure and count how long it takes for the normal pink color to return. In a healthy person with good circulation, that color should come flooding back in less than 2 seconds. If it takes 3 seconds or longer, especially if this is a change from their normal, that is a warning sign that blood flow is being compromised. But here is where it gets even more informative for seniors. You should also look at the skin on the arms, legs, and torso. What you are watching for is something called mottling, which appears as a blotchy, lace-like pattern on the skin, often with patches that look purplish or bluish mixed with areas of normal color. This mottled appearance happens because blood is being shunted away from the skin and toward vital organs, which is the body's emergency response when something is going seriously wrong. In older adults, you might also notice that the skin feels unusually cool to the touch, particularly on the hands, feet, and lower legs, even when the room is warm. Some families describe it as a clammy feeling like touching a damp cloth that has been left out. The combination of slow capillary refill, mild skin, and cool extremities creates a picture that should immediately raise concern. Now, I want to be clear that poor circulation can happen for many reasons in seniors, especially those with diabetes or heart conditions. But what you are looking for is a change from baseline. If someone normally has warm hands and 2-second capillary refill and suddenly their hands are cold and the color takes 4 seconds to return, that shift is what matters. Make it a habit to check this every morning, especially when someone has any kind of infection, even something that seems minor like a urinary tract infection or a small cut that is not healing well. These seemingly small infections are the most common triggers for sepsis in older adults, and the skin squeeze test can catch the body's distress signal before other symptoms become obvious. But as Important as skin changes are, there's another vital sign that tells us even more about how the body is coping. But before we continue, lock in your spot by hitting like and subscribe. The health truth you need is right after this. Number 4, do the temperature check twice daily. Most people think of sepsis and immediately think of high fever, but this assumption is exactly what causes so many families to miss sepsis in their elderly loved ones. Here is the surprising truth that every caregiver needs to understand. A major study published in Critical Care Medicine found that nearly 30% of elderly sepsis patients actually present with a low body temperature rather than a fever. This condition, called hypothermia in the context of sepsis, is actually associated with worse outcomes than presenting with fever. The immune system in older adults simply does not respond the same way it did when they were younger. The internal thermostat becomes less reactive, and the body may not mount the fever response that would typically signal infection in a younger person. This means that a temperature of 96 degree F in a senior can be just as concerning as a temperature of 102 degree in a younger adult. Both represent the body's systems going haywire in response to infection. To properly monitor temperature in an older adult, you want to check at least twice daily when they're healthy, so you've established a solid baseline. Most people do not realize that normal body temperature varies significantly from person to person and tends to run lower in older adults anyway. The old standard of 98.6 degrees is actually an average, and many healthy seniors normally run temperatures of 97.5 or even 97 degrees. Once you know what is normal for your loved one, you can spot deviations much more quickly. When checking temperature, use a reliable digital thermometer and take the reading at the same times each day, such as morning and evening. Oral temperature is fine for most people, but if accuracy is a concern, tympanic thermometers that read the ear, temperature or temporal artery thermometers that scan the forehead can be good alternatives. The key is consistency in how and when you measure. What should trigger concern is any temperature above 100.4 degrees Fahrenheit, which doctors generally consider a fever. But equally important is any temperature below 96.8 degree, especially if this is lower than their normal baseline. Neither extreme warrants attention, particularly if the person has any other symptoms or has recently had any kind of infection or medical procedure. You should also know that temperature and sepsis can fluctuate wildly. Someone might have a near normal reading in the morning and spike a fever by afternoon, or they might run low all day and then suddenly shoot up. Checking twice daily catches these swings that a single daily check might miss entirely. Keep a simple log of temperature readings along with the date and time. This record becomes incredibly valuable if you do need to seek medical attention because it shows the pattern and progression over time. Doctors can use this information to make faster, more accurate decisions about treatment. Temperature gives us crucial information, but there is another measurement that can reveal even more about how hard the body is working to fight off trouble. Number 3, the breathing count test at rest. Respiratory rate, which is simply how many breaths a person takes per minute, is one of the most overlooked vital signs in home health monitoring. Yet it is extraordinarily sensitive to what is happening inside the body. When sepsis begins to develop, the body needs more oxygen to fuel the immune response and to compensate for organs that are not functioning at full capacity. The lungs respond by increasing the breathing rate, often before the person themselves even notices that anything feels wrong. A study from the University of Pittsburgh found that elevated respiratory rate was one of the earliest measurable changes in patients who went on to develop severe sepsis, appearing hours before other vital sign abnormalities in many cases. This makes it an incredibly valuable early warning indicator that anyone can measure at home with nothing more than a clock or phone timer. To check respiratory rate properly, you need to measure it when the person is at rest and unaware that you are counting. This is important because people tend to unconsciously change their breathing pattern when they know they are being observed. The easiest approach is to watch their chest or abdomen rise and fall while they are relaxed, perhaps watching television or sitting quietly, and count the number of complete breaths over a full 60 seconds. One rise and fall of the chest counts as one breath. In a healthy adult at rest, the normal respiratory rate is between 12 and 20 breaths per minute, with most people falling somewhere in the 14 to 18 range. In older adults, the normal range may be slightly higher, but anything consistently above 20 breaths per minute in a resting senior should raise a flag. Above 24 breaths per minute is definitely concerning, and anything over 30 is an emergency that requires immediate medical evaluation. But it is not just the number that matters. You should also observe the quality of the breathing. Is the person using their neck or shoulder muscles to breathe, which would indicate they are working harder than normal? Do they seem to be struggling or uncomfortable with each breath? Are they breathing through their mouth when they normally breathe through their nose? Can they speak in complete sentences without needing to pause for breath? These observations provide context that makes the numerical count much more meaningful. You should establish a baseline for your loved one by checking their resting respiratory rate on several normal days when they are feeling well. Write down what is typical for them. Then, whenever there is any concern about infection or illness, check the breathing rate again and compare it to that baseline. An increase of even 4 or 5 breaths per minute above their normal can be an early warning sign. The breathing count test becomes especially important if the person has any type of infection, has recently been hospitalized, has had any surgical procedure, or has chronic conditions like diabetes, kidney disease, or a weakened immune system. These are all situations where sepsis risk is elevated and early detection becomes even more critical. Breathing rate tells us about oxygen demand, but there is another simple pulse check that reveals how hard the heart is working to keep up. Number 2, do the pulse check morning and night. The heart is essentially the body's main pump, and when sepsis starts to take hold, the heart has to work over time to maintain blood flow to vital organs. This shows up clearly in the pulse rate, making it one of the most valuable home monitoring tools available. When the body is fighting a systemic infection, it releases chemicals that cause blood vessels to dilate it and become leaky. Blood pressure can drop, and the heart compensates by beating faster to try to maintain adequate circulation. This elevated heart rate, called tachycardia, when it exceeds 100 beats per minute, is one of the hallmark signs of sepsis. A large-scale analysis published in The Lancet found that heart rate above 90 beats per minute, combined with any suspicion of infection, was strongly predictive of poor outcomes if left untreated. To check pulse at home, you can use either a manual method or a device like a pulse oximeter, which clips onto the finger and displays both heart rate and oxygen saturation. Both approaches work well, but the key is doing it consistently and at the same times each day. For the manual method, place your index and middle fingers on the inside of the wrist just below the base of the thumb and feel for the pulsing of the radial artery. Once you locate it, count the beats for 60 seconds while watching a clock. You can also count for 30 seconds and multiply by 2, though the full minute count is more accurate, especially if the rhythm is irregular. Normal resting heart rate for adults is typically between 60 and 100 beats per minute, but this varies significantly based on fitness level, medications, and underlying health conditions. Many seniors take medications like beta blockers that specifically lower heart rate, which complicates interpretation because their heart rate might not rise as much in response to infection. This is why establishing a baseline is so crucial. You need to know what is normal for this individual person. Check the pulse when they are calm, rested, and feeling well. Document what their typical resting heart rate is. Then when there is any concern about illness, you can compare to that baseline. An increase of 15 to 20 beats per minute above their normal resting rate is meaningful, even if the absolute number is still within the general normal range. Beyond the rate itself, pay attention to the rhythm. Is the pulse regular and steady, or does it seem to skip beats or vary in intensity? While irregular rhythms can have many causes, a newly irregular pulse alongside other signs of illness is additional cause for concern. If you're using a pulse oximeter, you get the bonus of seeing oxygen saturation at the same time. Normal oxygen saturation is typically 95% or higher. Levels below 92% in someone with suspected infection are concerning and may indicate that sepsis is affecting lung function. The combination of an elevated heart rate, even mild elevation, plus even slight dips in oxygen saturation creates a picture that should prompt you to seek medical evaluation promptly. Pulse monitoring is powerful, but there is one check that research shows is even more predictive in elderly patients, and it is the one that families miss most often. Number 1, do the mental clarity check throughout the day. This is the check that the Johns Hopkins study I mentioned earlier identified as the most sensitive early warning sign of sepsis in older adults, and it is tragically the one that families most often dismiss. A change in mental status, which includes confusion, disorientation, unusual drowsiness, or just not seeming like themselves is frequently the very first sign that sepsis is taking hold in a senior. It often appears a full day or more before fever, elevated heart rate, or other classic symptoms show up. Yet, over and over again, families attribute these changes to fatigue, a poor night of sleep, or just normal aging. Let me be very direct about this. Sudden confusion in an older adult is not normal. It is a medical red flag that demands attention. The brain is exquisitely sensitive to changes in blood flow, oxygen delivery, and the inflammatory chemicals that flood the bloodstream during sepsis. When these levels shift, the brain responds almost immediately, often before other organs show any signs of distress. This is why mental status changes are so valuable as an early warning system. To monitor mental status effectively, you need to know how your loved one normally functions and interacts. What is their baseline level of alertness throughout the day? How do they typically respond to questions? Are they normally oriented to the day, date, time, and place? Can they usually follow a conversation and respond appropriately? Can they normally recognize family members and recall recent events? Thank you so much for watching.